Start our webinar, so I have my tea. Good afternoon, dear colleagues. Just have a cup of my tea. Last weekend of summer, so we are going to speak about lips beauty, and as you know, the female beauty has always been a seductive power and strong weapon, and therefore the issues of maintain beauty are always crucial. And as you know, lips is a very important part of the female face, and which always attract the attention and interest from others people. And it's interesting fact, very well-known fact that it's very interesting for us that for example, Aristotle believed that the shape of the lips and mouth of a person is an indicator of his state of mind. And very interesting statistics says now that the lips and eyes correction procedures, rejuvenation procedures, increased up to more than 300%. This is scientific publication from American Association of Plastic Surgeon Association. So it means that these procedures become more and more popular, and the question is why? And actually the answer is full lips of proper form with ideal symmetry always were evidence increased sensitivity and sexuality. And I would like to show you, this is very interesting fancy magazine, Elle and Vogue, and I try to analyze how many people try to find some articles about the lips, and you will see that the more than 83% of the readers of Vogue and 80% readers of the Elle magazine asked the question about the lips augmentation, lips enhancement, lips volumization. So it's become more and more popular. And to continue, let's have a look at this slide. As you can see, the topic of lips beauty and the volumetric procedures of the fillers injection come out of the top at the request of aesthetic and dermatologist, plastic surgeon, different congresses, websites, internet, Instagram, or etc. And this topic is raised on the congress and forums and discussed on the pages on the internet and specialized magazines, and they're becoming more popular and more popular all around the world. And today, I would like to talk with you about the main principles, but in the same time, we have a lot of complication after lips procedures. We have a lot of horrible results. We will have a lot of unnatural results, and nobody can explain us some systematic principles how to achieve the best result, natural, sexy, attractiveness. That's why today I would like to speak about the principles of lips correction and analyze my own clinical practice, all my own clinical examples, and to talk about it, and of course to talk about the recommendation of the Russian and international lips expert. So let's start and let's do it. And first of all, let's speak some words about lips fashion. Why it's so important for me? Because your taste, your beauty, your attractiveness is very, very important for the best results. I would like to say to you that the statistics say that aesthetic procedures for the lips and the eyes, as I told you before, have increasingly more than 400%. And is there any rules in of fashion lips? So my question is, if we have some rules of fashion, what is more popular, big lips, big sexy lips, or naturals? What is the tendency of modern world? What is the tendency of fashion lips? It's interesting. However, today the fashion is so fickle that the women frequently don't know what they really want, and there are so many factors that influence the choice. That's why I think that we need to investigate some objective criteria how to find the ideal variant for lips for your patient. So I would like to speak about individual therapy of lips, so personality therapy of lips enhancement, lips volumetric procedures for your patient. And popularized by celebrities and social media influence, the lips filler market for female, especially for young patients, for millennials, is on the first track to growth. Lips beautification with HA fillers is currently among the most frequently requested procedures in aesthetic practice. The use of different HA gels, different HA fillers has increased. It's very interesting. Between 2000 and 2015 by 274%, and from 2000, last 5 years, from 2015 to 2020, upper than 300%. And the most frequent location for the facial volumizing procedures, especially for young patients, for young population of our clients, are lips. It's very interesting. It's a very interesting social tendency, and I try to find to check the Instagram pages for the famous bloggers and famous influencers of Instagram. And let's have a look at this slide. The looks typically is the same: big sexy lips, and we live in a world in which celebrity looking lips for perfect selfie like that is obvious trend for people with a different age, especially for millennials generation. That's why, for example, according to eMarketer, 78% of millennials say that they spend more than 2 hours per day using their smartphone, and 87% of our patients say that they never leave their phones, their side day or night. That is why it's very important to thinking about the proportion when we want to achieve an excellent result with a positive feedback. So our aim that the people come back and come back and come back again and again and again to our office, because we need to more clients. We want to be more successful, more success, more reach, etc. And of course, during the correction, we cannot it's a horrible examples, right? We cannot forget about the proportion, and we still meet the girls with a very ugly and unproportional lips, looking like a cartoon monster. Let's have a look at this slide. So all the time, please thinking about the proportion, all the time thinking about the fashion, all the time thinking about the sensitivity and sexuality. And otherwise, your clients look typically the same, like on this slide. So you are very different by fingerprints, right? So no unique. And one more interesting tendency at this moment, and I ask my daughter, she is 12 years old. Do you want to increase your lips? Do you want to have a bigger lip? And she's 12. And she's like, oh yeah, mom, this is my dream. I say, my goodness. And to be true, at the moment, the demand for lips, volume lips procedure among the teenagers, so I mean the people 15, 16 years old, is increasing. So I want new lips, and I already made an appointment. Let's move ahead. That's why it's very important to have a plan. To have a plan how to make ideal, wonderful, beautiful, sexy, attractiveness lips. And we need to have a plan how to do it very natural, safety, effectiveness, and with a good positive feedback for us. And my recommendation to you is to follow with me our plan, A, B, C, D, etc. The aim of aesthetic facial treatment, for example, lips treatment, lips augmentation, are correction in harmony with the facial features, recovery of lost volume and natural tone of vermilion, creation of the supporting framework in the projection of the barcode lines and marionette lines as well, correction of the asymmetry, increasing the delicate, increasing the volume, and of course correction of the age-related changes. And always we need to put in our box, beautiful box for beautiful lips, artist diagnosis, anatomical integration. We need to choose the products, the right products for correct indication. We need to find ideal instrument, I mean needle or cannula, and never forget about estimating amount of the product for our safety. First, for our safety. So this is a very important moment. And let's have a start with a lips anatomy, because it's our basis and what should be considered basic principles. Excuse me, I hear some voices. So everything is fine? Please switch off the microphone because it's difficult for me.
No, Tal from Alpha Medics joined us to take care about the question of the...
Okay, because I hear some voices, some noises. So.
Meanwhile, Tal and I will be muted, and we will wait for the end of the webinar.
Yeah, please. Okay, I'm going to continue.
Yes.
So, what should be considered? Always keep in your mind basic principles of correction, knowledge of anatomy and knowledge about the dangerous zone. And treating the lips to increase the facial attractiveness and usefulness is changing when trying to consider first ethnic difference, of course, in a different society. The injection techniques presented in different studies are based on experience and, of course, personal selection of different authors. And I would like to show you different techniques from different authors today. And injection the lips can be difficult, especially when having in our mind that the labial arteries can be everywhere. So today I would like to recommend you the safest way how to prevent any complication, how to choose a cannula or needle, at what is the length of the needle, at what is the length of the cannula, what is the diameter of the cannula. So some pearls of different techniques. Okay, first let's start with anatomy. Treating the lips and its anatomical correlating respected to vascular compromise. It was published, this article, it was published in last year, 2019, and cadaveric verification was performed in 2019 for each of different technique, I mean superficial, deep, needle or cannula, to identify it was made by Dr. Sebastian Catafana and co-authors. It was performed to identify the position of injected product inside the lips and its relation to the superior and inferior artery, labial arteries. The result of anatomical analysis revealed that in, attention, 58% of the performing injection, the product was placed very, very close to the labial artery, superior or inferior labial arteries. In 60% of the cases, application using the needle, please, it's very important for us. Please be focused. In 60% of the cases, again, application with the needle, using a needle, placed the injection product very, very close to the artery localization, where in 57% of the cases using the cannula placed the product in close to the artery again in the largest localization, so close to the superior and inferior labial arteries. This anatomical study revealed that injection material into the lips is frequently placed in a close proximity to labial arteries, presenting a high risk intravascular injection, intravascular application, leading to tissue necrosis and potential high risk to embolism, and it means potential high risk of blindness. That's why deep understanding of the anatomy is a very, very important for us. And today I would like to recommend you some pearls, some unique technique how to prevent it. This is very important for us. The modern papers show us that the arteries are most frequently deep in 80% of the cases. And another papers revealed that the most frequently application injection technique position of the fillers next to the artery in 60%. And let's have a look at this slide. You can see some anastomosis between the facial artery, between the branches of facial artery, superior labial artery, septum columellar artery, and these are huge numbers of vessels. This is a high risk of embolism, especially if you provide deep injection. In a case of the needle, more than 60% of the risk, and in a case of the cannula, 57%. It's totally the same. On this slide, I would like to show you the anatomy of the lower lip. As you know, the inferior labial artery is a branch of the facial artery at the level of the oral commissure, and sometimes it's absent, departs from the facial artery to the edge of the lower jaw and enters the marginal part of the orbicularis oris muscle. And this is a very important, this is a distribution of the pattern of superior and inferior labial arteries. It was published in 2017, and the name of the article is Impact for the Safe Upper and Lower Lips Augmentation Procedures, and understanding the precise position and course of the superior and inferior labial arteries within the upper lip and the lower lip is crucial for the safe and complication-free application of the fillers, especially when you use a volumizing technique, like a perpendicularly deep injection, like a Paris technique, like a sexy lips, like a rabbit lips, like a dark lips technique. Always thinking about anastomosis, always thinking about the anatomy, and based on the result of this investigation, the safer, this is the first conclusion, the safer location for the application of the volumizing HA gel for the volumizing lips procedures is subcutaneous plan. It means the most safety zone is a paramedial location both of the upper lip and the lower one as well. And care has to be taken when aiming to inject the middle line, as an artery can be identified more frequently in the middle line in superficial position. So be careful when you inject very, very superficial in the position of middle fascial line. This is a three different position of superior and inferior fascial artery. I mean labial arteries, of course, and it were identified first some mucosa. So I mean it's between oral mucosa and musculus orbicularis oris muscle is in a 78% of the cases. Second place is intramuscular. It means that it between intramuscular, between superficial and deep layers of orbicularis muscle in 17.5% of the cases. And finally, localization of the labial artery, subcutaneous position, means between the skin and between orbicularis oris muscle in only 2% of the cases. Actually, variability in changing of the perspective position along the labial courses was in 29% of the cases total for the upper lip, and individual variability for the lower lip fascial artery branch, labial artery, was in 32% of the cases. And the middle line location identified in the both upper and lower lips to be most variable. So be careful when you inject from this direction to the middle line using the long cannula. Sometimes we have an artery very, very superficial in the middle line in a position here on the projection of the central fascial line. Now, this is my advice to you. This is my clinical experience based to the different clinical trials. Thus, let's have a look on this table. The question where to inject, this is more frequently question that the doctor all around the world ask me. Where I need to inject, doc? The answer is simple. When you see the tip of your needle, or when you see the tip of your cannula, you are safe. That's why today I would like to present to you the safest, it's true, the safest technique using the Belotero Lips shape or contour product is blanching. So I mean a very, very superficial technique is a blanching of lips mucosa. As soon as you don't see the tip of your cannula, as you don't see the tip of your needle, you can assume that you're close to the artery. More safe is use a superficial technique, superficial injection contouring technique, superficial volumizing injection technique, and both effects can be achieved by both instruments, needle and a cannula as well. And choosing the right products, I mean the Belotero Lips product and the depth of injection, you can increase the safety during the lips volumization. And here, this is a red color, so I mean the dangerous zone. Here on the center is the dangerous zone. It's safety. It's the safest zone, and it's again the dangerous zone. So to summarize, the dangerous zone for the lips volumizing procedure are medial segment of the lips, some mucosal surface location of the artery, because very often we can see very often oral commissure of the mouth. The labial artery is located superficially on the border of the red border and mucosa. Let's start to analyze the lips, because I would like to speak with you about some definition of ideal lips. There are some definitions. So the lips contour well defined, of course. The width of the mouth or the distance, it's the same like a distance between the commissurals. This parameter cannot be changed. So it's like an intrapupillar distance, intrapupillar line. So you draw intrapupillar line and it's totally the same. Nasal labial fold almost have determined. Distinguished structure, column of filter, cupid arch, contour, lips contour of upper and lower lip, and area of red border to the lower lip, and amount exceeds the upper area and volume and ratio could be about 2 to 1, something like that. To continue, very important to speak about not only aesthetic, but also about the teeth, about the bite, about the dentist aspect of the lips correction. And here we see not only aesthetic, but also dentist using the golden ratio proportion. There are some proportion about the upper incisors, as you can see on the, because we're speaking about not only its lips, but not only aesthetic, but also in a dynamic. So we need to analyze the teeth, we need to analyze the incisor, for example, two front teeth from a rectangular according to the golden ratio of the two front teeth is equal, perfect smile. And the height of the chin to the height of the upper lip, the ratio is like a golden ratio, 1.6 to 1. And for example, on this slide, ideal unique features included the full oval, oval shaped cheek, and of course the chin, the round chin, with a 0.6, 0.9 length ratio of glabella or nasolabial angle, looking nasion, gonion, and we need to measure this distance for analyze the lips proportion as well, looking like a perfect baby face. And patients tend to have a full lips, and the upper lip may be little bit thicker than the lower one. Of course, it's some ethnic difference, it's some fashion trend, some fashion difference. The moderate proportion of the patient who request HA filler in their lips do so not increase their volume, but rather to create the better shape and better aesthetic balance. And as you know, we have some measurement of the lips. For example, on this slide, I would like to show you the Ricketts E line. So we draw the line, we connect the tip of the nose with tip of the point of the mantle zone of the gonion, and we will see some curves between the point of the nose and point of the most proximate point for the upper lip, and the distance, for example, between the Ricketts E line and upper lip is about 4 millimeter, 4 millimeter here and 2 millimeter respectively for the lower lip as well. And to achieve the ideal and natural lip, the proportion is 40-60, and it means that the upper lip is 40% to total length and volumes, the lower lip is 60% of lips and volume. And let's have a talk a little bit about the bite. So I'm not a dentist, I'm a dermatologist. So of course, I make some cooperation with my colleagues, with dentists and orthopedics. And the bite is very important. It plays a huge role for the lips enhancement, and based on the bite, we can use different techniques for lips augmentation. That is why we always need to analyze not only the dermatological aesthetics parameters and history and anamnesis, but also the dentist and neurological anamnesis and orthopedic anamnesis, orthopedic history, to make our work maximally effectiveness. And the most often pathologic bite seen in my patient, in case of my patient, is a distal bite. And the second most often is a medial bite. And let me show you some clinical examples. For example, for this lady, we have the third class of occlusion, and we use a very unique, very specific technique how to help her, how to improve her attractiveness, how to improve her, because it's very difficult cases, how to improve the volume of the, because it's invisible lips, upper lip. Let's have a look. This is a technique. When you perform the correction in the cases of pathological bite, it is necessary to take into account the light and the constant muscle activity. For example, orbicularis oris muscle of the upper lip. We use a point by point technique, and always together with botulinum toxin. Sometimes we mix it in the same syringe. Sometimes we use it in the different syringes. Rather than sometimes we use a linear injection, short linear injection technique for the correction of the contour of the upper lip and increase the volume. And we can use the technique from Dr. Javier Butte and Dr. Van Eyck. It's called Van Eyck technique. What does it mean? It means point by point here, high viscosity, high cohesivity filler, and it's necessary to introduce HA gel in the form of microboluses technique, as I show you on a picture on this photo, along the border of red border of the lips and the form of separate columns and submucosal layer filtrum to form the column here in some mucosa, and at the same time to form the filtrum, to form the red border using linear retrograde technique to increase the area of volume of lips and to restore the main parameter of the lips. So my recommendation in a case of thin upper lip and pathological bite third-class occlusion, please, first, use a Belotero Lips shape product. Second, total amount for whole procedure for upper lip is around 0.6. Technique are microboluses, linear retrograde technique by Dr. Van Eyck or by Dr. Javier Butte, and the level of injection is some mucosa plane. Let's have a look. I want to show you some details about the technique. This technique was prescribed by Dr. Javier Butte. He's a very, very famous, well-known doctor from Spain. And he prescribed this technique and he named it non-touch technique. The correction of the lip with the help of linear retrograde injection along the border of the red border, and we use a very, very small amount of the product, is around 0.05 milliliter of the product per one injection of HA gel. You can use a Belotero Lips shape product. On average of the both lips, you use 0.6 milliliter totally. To restore or create the lateral position, lateral projection of the lips, you use a needle or cannula. Needle is inserted into the dermal here, white part, dermal part of the lips, and after passing through the orbicularis oris muscle, inject gel here in the projection between the wet and dry mucosa in the border here. And to increase the volume of the lip is necessary to change the angle of the injection and introduce the product already under the lower boundary of the red border. So let's have a look here, more in the projection of the dry mucosa here for the volume, and here wet mucosa plane. Let's have a look here, wet mucosa plane for the restore the projection of the lips. One more interesting question: how are lips changing with age? Let's have some discussion about young lips and age lips. And this slide show you some difference between young lips and age lips. If we go deeply, we will see that the lips of the same height, thin lips, and during the age, we will see the flattening of the central part of the lips, I mean the tuberculum of the upper lip, unclear contour, unclear shift of vermilion of skin part, enlarges skin part of the lips, flattened column of the filtrum, oral commissura going downwards. We lose the color of the lips, we lose the volume of the lips, and and you can compare, for example, 1 second, yeah, it's okay. This is we made for MERS. Last year we performed 1 clinical trials, and we analyzed a mother-daughter couple. So she's a mom, she's a daughter. Let's have a look to her lips. It's going to be thinner and flatness and reduce the volume. Again, mother-daughter couple, oral commissure going downwards. It's no coloring, flattening, losing the basic structures. I mean, filter column, tuberculum, cupid arch, and of course, for the young lips and for age-related changing lips, we need to use different technique, different amount of the product, and different procedures. And this is a very funny, slide because this I would like to show you the dosage and the choice of the product for the lips correction of your HA filler. So we have a range from Belotero Lips contour to Belotero volume, and the choice of the product is depend on age of your patient, gender, so I mean sex, what your patient really want, I mean fashion, anatomic consideration, and for example, lip of small volume. Or if your patient asks, oh doc, I don't want to have a big volume, I just focused about cirrhosis, about I need a degradation, I need registration of my lips, I need to procedure lips refresh. So my recommendation to you for lips refresh, please use a Belotero Lips contour for the contour and for volume as well. And if you, I always ask my patient, what size of the lips do you prefer? It's the same like a clothes, like your dress. If you wear the S size, if you want to have an S size lips, please, the amount of your product, so it's mean natural, very natural lips. The amount of your product, total amount, is 0.6. If your patient asks you about medium size, about natural lips technique, about middle size volume, please use 1 milliliter of filler. You can use Belotero shape plus lips shape plus Belotero lips volume, or you can use Belotero intense for lips augmentation. If your patient wants or asks you about plump lips of pronounced volume, about sexy lips, the total amount of the product could be 0.5. So it could be, for example, 2 syringes of Belotero Lips shape, and your patient have could be looks like a superstar, like a full, sexy, with a proper form, lips with well-defined contour, with a big, sexy volume. Or if your patient wants XL size, like dark lips, I don't know why they ask us about this, but sometimes it happens. I recommend you to use a Belotero volume and high dark. So it's and the total amount could be around more than 2 milliliters, but it's not physiologically, it's not safe. I don't like to do this, but some doctors like. I don't like to do it. And this is very interesting table that showed you the choice of Belotero with a stabilized HL gel for the correction of different aesthetic problem in a periorbital area. We have three different forms of Belotero. Low concentration, it could be Belotero Lips Contour or Belotero Balance. I recommend you to use it for white roller and sometimes for lips refresh technique, medium viscosity and medium elasticity, and high cohesivity product with a concentration more than 22, 25. It could be Belotero Shape, Lips Shape, or Belotero Intense. You can use it for red border, vermilion, white border, for filtrum, for thickness, for upper lip and the lower lip, and for reduce the wrinkles in the projection of the marionette lines, or lift up procedure with oral commissure, and high concentration more than 25. It's a Belotero Lips Shape or Belotero Volume. Sometimes we use it for oral commissure, or sometimes you can use it for lips volume augmentation, but in my imagination it's too much. Next slide show you the most safety technique, and I would like to remind you that we can use two different instruments. First of all, we can use a cannula. And for lips treatment, I prefer to use a cannula 25 gauge cannula, 55 lengths. Or sometimes you can use a needle. First, about the cannula here. I would like to show you the cannula technique. And this is the publication decreasing the side effect rate after adopting the bloodless automatic technique, a single cosmetic surgery center experience of 360 lips injection over 1 year. And this percentage is a percentage of the localization of labial artery, superior and inferior labial artery. So the most dangerous zone here is a deep zone, the most safetiness. Again, there is superficial position of your cannula. And let's have a look. This is a 4-point injection technique. The lips were divided vertically. You draw intrapupillar line. And lips were divided vertically into 2 equal parts, medial parts and lateral parts. 4 entry points were made 5 mm here, 5 mm like a Javier Bill technique, above and 5 mm below the center of the vermilion border for each side. And the filter was injection in some mucosa projection, in some mucosa plane, in some mucosa layer, using a cannula with a fanning technique. And let's have a look at the slide before and after. It looks amazing. And let's come back to the needle injection. This is a needle injection. It's very interesting because for safety reason, I recommend you to use a mesotherapy short needle. Let's have a look here. So you don't use a needle which you can find in the standard complex of the filler. It's a long needle, length 13 mm. So I recommend you to change the needle when you inject your lips with a filler, with a Belotero Lips Contour or Shape. Please use the here 4 mm length, and safe technique of the lips volume correction is submucosal layer using Belotero Balance or Belotero Lips Contour for moisturizing, for very delicate volume enhancement, and sometimes we can use a Belotero Intense or Belotero Lips Volume for more pronounced volume effect. Let's speak about the xerosis, and let's speak about the Belotero cocktails, and let's speak about invisible lips and very disproportional lips. Sometimes we can combine For example, your patient said, no, oh doctor, I don't like to have a big lip. I have a well-defined contour, and I don't like the xerosis. I want to achieve a rehydratation effect with a very well contouring lips. Say, okay. And sometimes you can combine, for example, Belotero Intense for restores the frame, work with the oral commissure, contouring, or Belotero Lips shape. And in the same time, for treatment of the xerosis, you can use Belotero soft with lidocaine or without lido, and space formation for the other. Sometimes it's like a first step before another gel or lips xerosis therapy. And this is a very good combination, and a lot of patients absolutely happy about this. And again, correction features. Always start the most viscosity fillers in the cases with very thin lips. Step by step, layer by layer. High viscosity, you start with a high viscosity filler. For example, you prescribe Belotero Lips shape for the first visit. And for the second visit, repeat it after 3 or 6 months. And again, and increase the volume bigger, 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 and bigger. And a good result you can find in 2 or 3 years. For example, you can start with a Belotero Intense, and the follow-up procedures you can use a Belotero Balance, or you can start with a Belotero Lips shape. And for touch-up visit, for follow-up visit, you can use the Belotero Lips contour, like a sandwich technique. Belotero Lips shape, after 1 month, Belotero Lips contour. After 3 months, Belotero Lips contour. After 6 months, Belotero Lips contour or Belotero Lips shape. This is an interesting protocol. And for treatment of xerosis, of course, scission lips xerosis, dry lips after, for example, smokers, after taking some medication, deficiency of vitamins and microelements, frequency 1 time in 2 months, like a bioreutilization technique, linear retrograde technique, or blanching technique. You can use a Belotero soft for xerosis treatment. Or in the case of pronounced xerosis, like for this lady, let's have a look. You can use a Belotero Balance or Belotero Lips contour, like a striate here, a lot of wrinkles on the contour, striate, like a stria lips, or delicate correction to start, like a start to like a procedure to. So I want to try. Your patient said, you say, okay, let's start with a Belotero Lips contour or Belotero Balance, and after that we will see. And sometimes, as I showed you before, we can use a various scheme how to combine Belotero Balance, Belotero Intense for lips enhancement, or Belotero Lips contour together with Belotero Lips shapes in the same procedure. And this is different technique. I would like to show you this table, different technique. I prescribed the recept, how to do it, the correction, features of the correction of structural element of lips and periorbital area are correction of the lip contours, correction of the vertical wrinkles around the lips, the barcodes treatment, correction of the the decrease of volume, especially in the lateral part, and lips volume correction in the lateral part and medial one. And here one more technique. This is especially for oral commissure. You can use a Mona Lisa lips technique to lift up the oral commissure. You can use the triangle technique. You can use a reinforcement technique. Sometimes for barcode, you can use the microboluses, micropapal technique, or cross-section technique. And if you ask me, what is your best technique? What is your choice? What do you prefer? For example, for barcodes, my choice is a Belotero with the soft blanching technique and correction of the periorbital wrinkle, always beginning with the introduction filler along the contour between the white border, like a white border projection between the dermis and wet mucosa, dry mucosa, I'm sorry, and only then your product is injected along the courses of the wrinkles. And sometimes you can use a fanning technique, linear retrograde technique, reinforcement technique, and always control the depth of injection. For barcodes, it could be intradermal injection. Here for red border, please using some mucosa plain injection technique. And this is some clinical recommendation about the blanching technique. It's a unique technique, provide additional opportunities to aesthetic doctors. It was prescribed by Dr. Patrick Michels from Switzerland. And this is a very superficial technique. Please use it only for Belotero, otherwise you can have a complication like a Tyndall effect, overcorrection syndrome, and very superficial, administered directly under the dermis and achieve the whitening effect. Let's have a look here. Occurs after 1 to 5 minutes following the diffusion intrapapular layers of the dermis, and leads to a long-term result and unsurprised the smoothing of surface of the face wrinkles. And this is very, very unique, and no other fillers on the basis of doesn't allow to achieve of a gel doesn't allow to achieve the same result in the technique of whitening. So please, for blanching technique, for reduce the barcode wrinkles, use a Belotero Lips contour product or Belotero Balance. Sometimes, especially with very, very thin atrophic skin, you can use a Belotero soft product. Use a needle, 30 gauge. Injection angle is 10 or 12 degrees, and injection technique is multi-point techniques. Let's have a look on short video how I do it. Again, 30 gauge needle. So for this patient, I treat her barcode like a stria lips. Could you see I'm blanching? Here, white area, and it could stay on your lips around 30 minutes, half an hour, and after that it disappears together with the wrinkles. So it's absolutely new, absolutely unique. The cut of the needle could be up, the depth of injection subepidermis, the angle of injection is 10 or 12. Very, very, very parallel to the surface of the skin surface. And we continue here and along the red border projection. We apply the product alone to whole area, whole of this area, from in medial part and paramedial part and in the lateral part as well. All of this area, whole area. And how it looks immediately after procedure: no blood, bleeding, no swelling, and this white color disappear in half an hour. Okay, let's have a talk about lips volumetric technique. And about the size and shape of the lips. I don't like to look like a big fish lips, so I would like to speak with you about the fast beauty lips trend. Let's talk about fast beauty lips trend. So, what is the modern ideal beauty lips? As a patient come to my clinic, come to my office, they often bring the photos of some famous people. They often open their iPhones and show me the Instagram, some celebrities. But the tendency is still full, young, more or less natural lips. But some of my patients still ask about big, sexy Russian style lips. So let's talk about different opportunity. First of all, if you have a hyperactivity of orbicularis oris muscle, in the case with a very thin lips, with a very constructive, in the case of age-related change in lips, in the case of a smoker, as well as if you want to achieve a lift up effect, like a lift up the more lateral part of the lips, you must use the botulinum toxin like a preparation stage. Here you can see the treatment protocol. A total dosage, so for botulinum toxin, for Botox or Xeamine is 4 units from 2 to 8 units in projection of the fibrous orbicularis oris muscle. Number of points, 2 injections, 1 centimeter from each other, the distance between injection point. The distance between oral commissure and your injection points is around 7 or 10 millimeters. And the distance between column filter and your injection point is around 5 or 7 millimeters as well. If you want to see the lift up result, I recommend you to provide injection very, very superficially in the projection of the red border. If you want to treat the barcode wrinkles, this is your treatment plan. Let's provide the injection 1 centimeter up to of the vermilion border. And this is a total amount of the different product, for example, from 5 to 10 units of Dysport, 4 or 6 units of the Xeamine, and always we need to correct together with the DAO and with the Mentalis and with the Platysma banks, because for us it's very important. Articularity is very important. The position of the teeth is very important. The position of the lower part of the face muscles. So that's why in most of the cases I combine not only lips but also whole zone, whole lower face treatment, botulinum toxin therapy. If we are speaking about only lips, my concept is that we have is two forms. In my medical imagination, based on a scientific background, based on clinical trials, we have only two forms. And we can classify our patient into two groups. First, we have an M form, and second, M here, like a mountains, like a M, McDonald's, Metro. And the second group is O form, smoothing, no defined contour, not very well defined philtrum, no very well defined cupid arch. And based on the golden ratio, we can classify M or O form lips in a classic form. It means ratio of upper lip to the lower lip is 1 to 6, 1 to 1 to 6, equal lips. The second part, M or O form. Predominance, the third class, is predominance of the lower lip is a clear predominance of the lower lip. With the high ratio greater than 1 to 1.6. And the last one is prevalence to upper lip. Again, the two form, M or O, the apparent predominance of the upper lip of the lower one. Again, only two forms, M form or O form, and for classification, for classes, classic, equal, predominance of the lower lip, or prevalence of the upper one. That is, it's very easy to understand it and very easy to, we can use this classification for the correction. For example, first group, M form. Let's have a look on this slide here, like a McDonald's, like a Metro. Before and after. How to, like a butterfly, how to achieve this effect and which product I recommend you to use. For achieve the like an M effect, with patient with an M form, please use to increase the volume of red border and making the full lips, please use a fanning technique. So this is your entry point. Injecting some mucosa plate using the fanning technique. The distance between injection point, it could be around 5 millimeters, and always use, please, injection technique. And opposite side, opposite fanning for restores the medial projection of the lip, for restores the tuberculum. Again, some mucosa plate. Inject, please use the needle or cannula. I prefer to use the needle for this clinical situation. To improve the control, I recommend you to use a Belotero Lips shape volume, and for volume, the same Belotero Lips shape volume with a concentration of HL gel 25 milligram per milliliter. Quite larger volume of a product are introduced, and the amount of the product depends about the size, which size do you, your patient prefer. Small size 0.6, big size 2 syringes of Belotero Lips shape. And for the contour restoration, always use for M4, always use a linear retrograde technique. And in this case, I recommend you to use a Belotero Lips shape or Belotero Intes as well. Some mucosa plane, you start from the oral commissure to direction from laterally to medial one. And you, of course, never forget about cupid arch, columella, and tuberculum. And this is a treatment result for M form. Sometimes for this lady, she has asymmetry of the lips. Again, fanning technique help us to restore the asymmetry. And this is a technique how to restore the asymmetry and how to restore the point of Glagauck line here and provide the medial rolling, medial lift up effect. And some patients ask us about this kind of the result. Again, this is M form, like a McDonald's, using fanning technique, the depth of injection, some mucosa plane, the total amount 0.6 for upper lip, 0.2 for lower one, oral commissural lifting, and restore the cupid arch and restore the philtrum column. This is a very nice result. Big, sexy lips, fashion lips with the Belotero Lips shape. This is schema of injection. Again, the fanning technique, medial parts, and lateral. Sometimes you can use a microbolusing in the projection of oral commissure. We use a filler based on stabilized HA with a concentration of 25. So it means Belotero Lips shape. Again, for example, in a case of age-related change in lips, you also use a fanning technique, for example, in this clinical situation, for lifting oral commissure, always together with the botulinum toxin, for example, for Dow, for platysma bangs. The depth of insertion is 2 mm, fanning technique, and the volume of filler is on average around 1 milliliter. Belotero Lips shape. Again, M form, before and after, restores the asymmetry, restores the coloring, and for this lady, I use the Belotero Lips contour for restore the contour of her lips, and fanning technique for restore her volume. And for more sexuality, for lower one, I prefer to use dental floss, the thread. I apply thread between the medial teeth, and they push it, and I inject 2 boluses like a cherry lips for more sexuality and more fashion of your lips, of your patient lips. I would like to show you how I do it. This is my dental floss. This is my thread. I show you on my mind. Here I put it, patient keep it, push it, and then inject on the right side. As you can see here, Belotero Lips contour, and the left side as well. And this is like a border between, it looks like an Angelina Jolie lips with some borderline between the right cherry bolus and the left cherry bolus, and it looks amazing. I would like to show you the clinical example here. Amazing. 2 boluses, disappear threads, right and left, and fanning technique for the upper lip. This is the M form. Okay, this clinical example. But what about the side effects? What about the complication? Of course, it's a break in the lips proportion. There are dark spray clips, excess filler in the center of the upper lip, which form the big upper disproportional lips, migration. Here looks like the overcorrection here. Overcorrection of the upper lip, which is lack of volume of the lower lip. Imbalance, sometimes you inject a lot of the lateral part of the lower lips and it looks like imbalanced squirrel lower lip, or augmentation of the lateral part of the upper lip or lower lip, and it looks like curtains here. And your patient smile, she couldn't smile, she cannot smile. It looks like a curtains. So please, in this case, using hyaluronidase to dissolve your product. Again, okay, next slides, some slides will be about O-form. Let's try to compare M-form with a very well distinguished part of the lips. I mean, philtrum, cupid arch, columella, and O-form with a smoothing some features, lips features. This is like a Paris lips form, O lips, like a O, smoothing. Before and after. How to achieve this result? In this clinical situation, I really recommend you to use the microbolus technique. It was prescribed, distinguished by Dr. Patrick Michels, the same like I showed you before for the barcode treatment. So for the lips, I would like to use in O4, I would like to use a monophasic gel, a high exclusivity, high and low viscosity, recommended for very natural result, no hematomas, very safe, no necrosis, no bloodness, the most effective in the correction of asymmetry, involutional and destructive lips, and minimal fillers volumes are used. So total amount of the product is 0.6. Let's have a look to this here. Techniques is microboluses 0.05 cc of HL gel, Belotero Lips control or shape in the medial and the lateral part. Sometimes we use a linear or retrograde fanning injection technique for the lower lip. And again, the level of administration is some mucosal layer. Sometimes we can use a fanning technique for the upper lip to lift up the oral commissure. And okay, yeah. Here is a Paris lips techniques to how to form the O lips, full lips, how to form the big, full, sexy O-form lips. The needle is inserted into the border, to the red border, and advances toward to the line of the here border between the wet and dry mucosa at an angle of 30-45 degrees, parallel to skin surface, to mucosa surface. Product is evenly introduced of the reverse course of the needle. So you turn back your needle and you inject. The distance between injection point is 2 or 3 millimeters. Additional injection of the products along the lips contour is not required. You don't need it. Sometimes we use a blanching technique, and the total amount of the filler correction of both lips varies from 0.5, 0.6, maximum 1 cc of Belotero. Some clinical examples, maybe some, yeah, this some principles. For example, for short upper lip skin part, I mean, you can inject for the visually extend the upper lip, but you can inject here and facing the columns of the philtrums along the antral length, and the filler introduce you put your finger here and you introduce by your filler by the linear retrograde techniques, and the injection area is fixed by your fingers or free hand. And the opposite situation, long age-related changes, long skin part, long upper lip. When correction of the philtrum has been performed, you fix it again between your fingers, but you use a pyramid technique. It means that a larger amount of the product is injected in the lower part of the lips, and which allows to use a visually, of course it's illusion, visually shorten the lips. They increase the size and the volume on this area of red border of the upper lip, harmonized as a picture as a whole face. And this is, of course, it's edema, but some clinical principles. One clinical secret in a patient who have a huge edema after the lips procedure, in the preparation stage, when you apply the lidocaine cream together, you can apply betamethasone cream, like a sandwich, for application anesthesia. Again, I repeat it for you. In a case, if you prognose it, that it could be big edema, some individual reaction of the patient, to prevent it, you can apply first amla cream and together immediately level up betamethasone cream for 15 minutes or 20 minutes, remove it, inject it, and your edema absolutely disappeared. So this is a clinical example of my patient Louisa before and after, or for blanching techniques. This short video. So high voices. How I do it. This is a blanching technique of the lips. Let's have a look. This is a product Belotero Lips shape. I inject it very, very superficially, point by point, all of the zone, from lateral to medial one, from red border to the border between the mucosa. No ecchymosis, no hematomas. Apply the sterile cotton pad, press it, provide the massage, soft, delicate massage, and it looks amazing, absolutely perfect. So let's, to conclude, the basis principle of the natural lips technique are retrograde technique, make an injection of the Belotero Lips shape or contour to return the stalk of the needle, uniform injection of your gel, of your filler without emission, insert the needle, insert your cannula and your product very slowly to avoid the edema, to avoid the bleeding, to avoid the hematomas. Make the volume of the red border by injection in the submucosal layer. Stop the injection of the gel of your product before you full removing your needle or your cannula. Avoid the overcorrection. Avoid the pressure, high pressure technique, and soft modeling massage. And actually, to summing up lips contour, my recommendation is linear retrograde technique, Belotero Lips contour, create the volume, fanning technique or blanching technique, depends on form, M-form fanning technique or form blanching technique, individual approach, and product Belotero Lips shape or Belotero Lips contour, depending what do your patient wants. And let me tell you some words about Belotero, because it's a new product from Merz. I love it so much. It's my favorite product. It's the best for me because Belotero Lips give aesthetic physician more creative power into new products that could be tailored to meet every individual patient needs and desires. And personalized treatment with a Belotero Lips contour shape can add to restore the natural looking volume of your lips and enhance the curves of the contour and gives more satisfaction about your lips, about your smile. And I could remind you that we have two forms. It's, for me, how I explain it to my patient. It's like a lips pencil, and it's like a lipstick and lips liner. The Belotero contour is lips liner. The Belotero lip shape is lip sticker. So Belotero lips contour is a 22 milligram per milliliter HA gel for lips augmentation, enhancing the upper and lower lip, and provide the clear contouring, and provide the natural lips effect. Lip shape, it's like a red lips liner for lips augmentation, enhancing the upper and lower lip, and it's 25 milligram per milliliter. It's more sexy lips. So first, more naturalness. Second, more sexy. Based on the CPM technology, very well studied product, high cohesivity, and the MERS provide a lot of clinical trials, and the conclusion is that the more than 95 doctors regard the squeezing out the syringe Belotero lips equally or better than early products. Extremely positive assessment, spreading the plasticity, reactability, high cohesivity, very easy to spread, very easy to massage, no side effects, no complications, so a high percentage to satisfy of our patient immediately after injection, and after 2 weeks, and after 4 months as well. And this is some characteristic of the product. Again, the Belotero lips, contour and shape for individual approach for your lips correction. Belotero lips shape for increasing the volume and lift up the corner of the mouth, and Belotero lips contour for increasing the vermilion border and restoring the lips contour, and for hydration of the lips. Okay, and so I would like to finish my presentation, and just for finish, let me show you some clinical example. Again, this is an O form blanching technique with a Belotero lip shape. She was extremely satisfied. She's crying, so this is the best lips in my life. Oh, Dr. Maria, thank you very much. You're magic. So she is 29 years old, Ekaterina. This is a very difficult clinical example. Very thin lips, unproportional lips. Again, O form. And this is very nice volume. So this is a result, Belotero lip shape after 2 months after injection. So it's not an immediate, it's not edema. This patient, before and after, Belotero lips contour, very delicate, very natural, prevention the xerosis of the lips. Of course, we can do it using the Belotero lips contour. And for summing up, my conclusion is, so factors that can affect the result of the procedure, like all the time check yourself about the anatomy, about the asymmetry at rest and the facial expression, scarring, tissue weakness,
Dr. Shirshakova?
Injections, features of bite, filter length, width of the cupid arc, and depth of chin release. And never forget about the anatomy, never forget about the proportion, and never forget about right choice of the product. In my hands, the best product is the Belotero lips contour and Belotero lips volume. Thank you for your great attention, and I hope that I will be I can help you in your daily practice to be more successful and to achieve the best lips in your life. Thank you very much.
Dr. Shirshakova, hi, good evening. This is Tal from Alpha Medics. How are you? There are a few, nice to see you. There are a few questions, if you can answer them. The first one is Mona Lisa technique, if you can say something about it. And the second one is, can you relate to papillon lips style in the upper lips?
Yeah, first.
Thank you.
First answer, second question. Papillo technique is this one. One second. Here. Oops. Here. This is him. Like this. This is papillo butterfly papillo technique. So use the fanning technique. 1, 2, 3, 4 injection point. Fanning, submucosa plane, small amount, lift up and provide big sexy lips. The result before and after here. Like an Instagram style. Everybody love it. This is the second question. First question was, can you remind me?
The first question was Mona Lisa technique, yes.
Yeah. Mona Lisa, where is it? I will show you again. Mona Lisa about the contouring. Here. This is Mona Lisa, number 7. Let's have a look here. I explain you. You use it for lift up your oral commissure, so you looks like Gioconda. You're always smiling. Magic smile. Again, 2 mm laterally, 2 mm up. Here, this is your injection point. Go through, very superficial, subdermal. Go through the oral commissure here. Let's have a look on the slide here. Go through the oral commissure to the projection of the contour of the lower lip. Inject your filler, return back. Inject. Don't remove your needle. Change the projection of your needle. Check of the position of the border of the upper lip. Inject the product slowly and uniform layer. Chuk, and return back here. So it looks like a, joker. This is what I mean, Mona Lisa technique.
Thank you. And then now there is another question about how to prevent lamps.
What do you mean, how to prevent lamps?
Lamps in the lips.
Lamps of the lips. First, right amount. Second, please use a Belotero, because it's happened when you use not Belotero products. If you use a Belotero contour, I'll show you. 1 second, because I am in my clinic. I say my clinic for you. No staff. I am alone because today is our, holiday, and especially for Alpha Medics, I come back to my clinic for you again. So this is magic product, guys. It's true, because in my clinic I use another product, so it's in my medical place. Last time, in my past, I used for example, another products, Allergan, by Allergan, Juvederm, and it's always happened with me. The migration, some like nodules, some migration here. The patient said, "Oh, doc, I have some boluses, I have some balls in my lip. And when I start to use a Belotero Lips, especially Belotero Lips contour, never happens with me. So my answer is, please, first, use the right product. Absolutely safety product for me are Belotero Lips shape and contour. It's true. Second, use a small amount for one injection point. What does it mean? 0.05. Most of the time, most of the clinical cases, you use a big volume for one injection. And never forget that after procedure, your gel attracts the water. And after that, it looks like a ball. It looks like a big volume here, like a pumping. And second, use a massage after your treatment. And the last one, secret. Always the total amount for first procedure for upper lip could be no more than 0.6. Sometimes you use a big volume and it's happened. Adverse effect or complication. So right product in right hands and the right amount of the product. That is how it is.
Thank you so much. Another question.
I'm happy that we have a lot of questions. It means that it was interesting for the doctors. It's good.
Yes. The question is, how can you tell that your needle is in the submucosal layer?
If you remember, I recommend you must to see the tip of your needle. You must to see the tip of your cannula. Let's have a look at the video. I found it. Here, for example, again. Let's have a look. Minimum angle of injection. Very superficial. No going deep. Very superficial. In the same case, if you use a papillon technique, you always visualize the tip of your needle. You always visualize the tip of your cannula. It means that you are in some mucosa plane. Otherwise, you're going deep, and it could cause complication. I mean, necrosis or blindness. Who knows?
Okay. I don't see any more new questions, so it means that
okay, because it's too late, huh? Everybody wants to go to bed, sleep.
There is another question. If a patient has an O-shaped lips and want to transfer it to M shape, can it be made?
No chance.
Okay.
If you have a brown skin or brown hair, so you never. So you can be little bit, I don't know, little bit blondie, but never. So it's genetics.
Okay. Let me see if there is something more. Any more questions? No, that's it.
Super. I'm super happy girl today. Always when I stay with Alpha Medics company and the doctor from Israel, I really missed you, and it's really sad that I couldn't come because you stay in the red zone by Corona and we the same. And I always keep you in my heart, in my soul, and I really hope that we will see each other very soon.
We are
Thank
really
you
hope
very
so.
much for your great attention and your great support and great opportunity, because for me, it's a great honor and great privilege to be with you always.
It's a great honor for us too, Dr. Shirshakova. It was a great presentation, and we miss you too a lot. And we really hope that soon we will be able to see each other, and that you will be able to visit us as we planned in the beginning, and have like some activity with you in Israel. So I wish you all the best and a good health and a good week.
Yeah,
Shavua tov.
You too. Good night, sleep well, and all the best for all the doctors.
Thank you so much. Bye-bye.
Bye. Warm hugs from Moscow. Bye.
Bye-bye.